It is my absolute pleasure and honor to host my good friend and colleague, Professor Mohammad Wasay from Aga Khan University, Karachi, Pakistan, who is very well known to the World Brain Day community, as he had been one of the biggest partner in crime to create this World Brain Day for the world the few years back, since 2014 onwards. Professor Wasay, very warm welcome back to the World Federation
Thank
Neurology
you, Tissa.
YouTube
Good
channel.
to see you. Tissa is also a big figure in advocacy. So we have worked together for last 7 years and even longer, for 7 years for the World Brain Day and maybe for like 10 years for advocacy. So it's good to see you. Thank you very much, Tissa.
Likewise.
Thanks for inviting me.
So tell us, how is it going in Pakistan at the moment in the middle of this pandemic? Is everything under reasonable control?
It's pretty reasonable control. We still have lockdowns and SOPs. We have vaccination going at a good speed, so about 300 to 400,000 people getting vaccinated every day. Our target is to get a vaccination of about 70 million people by September or October. So hopefully, if we are able to get that target, I think we should be able to get ourselves out of the danger zone. But we are still included in the red list of many countries, so people cannot go and travel to many of the countries in the world.
I think, as I said before we began this interview recording, this is a global problem, and we need to find the solution globally.
Very true.
This is no longer a national issue. Whatever that is happening in Pakistan would have direct impact here in Australia and other parts of the world very soon. Because we are so well connected. Stay safe and stay well. I know that you are one of the most excited advocates and academic neurologists in the world when it comes to World Brain Day. So as you are well aware, this year's theme is multiple sclerosis. Our ambitious aim is to run the campaign Stop Multiple Sclerosis. How excited are you to see World Brain Day campaign is flourishing, and this year we are tackling neuroimmunology?
That I think it's good and it's flourishing. I think we have created an impact, and hopefully we believe that the WHO will recognize this World Day as one of the important days which has improved care and awareness related to neurological problems. And now multiple sclerosis is one of the very important neurological diseases which affects young people across the globe, including Pakistan and India and China and large countries with large population as compared to North America and Europe. So it's a global problem like COVID, and it has affected millions of people. And it's one of the most important cause of disability in young people. So I think it's very timely and very important that the World Federation of Neurology has picked up this topic for awareness. And I believe that this awareness is going to make difference in lives of millions of people across the globe. So this is not a short, limited problem. It's a huge problem. It's a huge global problem. And it affects millions of people, not only the patients, but their family members and their extended families. So hopefully that this awareness will lead to improved care, decreased disability, and improved outcome of MS-related diseases in the world. And that's going to be a huge impact on millions of people across the globe. So I think I'm very excited, and I hope that this World Brain Day again creates awareness and a buzz in the community, especially the health community of the world. I think it would be very exciting for the patients too, who are suffering from MS, that World Federation of Neurology is focusing on MS and demyelinating diseases. And hopefully that this will also be a very boosting event for the patients and patients' welfare groups and communities.
I think you hit the nail on the head. You are absolutely spot on. When we reflect back, World Brain Day really has created a huge impact. I remember I think if I get it correct, you can correct me if I'm wrong. It was probably 2013 over a cup of tea or cup of coffee. I can't remember that. You, me, and Professor Vladimir Hachinsky, he was the president at that time. Again, you can correct me if I'm wrong. This was a casual discussion that a particular day for a brain. And then I think within about 2 days, I remember you making the announcement at the Council of Delegates meeting that we are going to launch First World Brain Day in 2014. And we didn't think that this would have this much of an impact. When we look back, last couple of years, we really shed light on really critical, important diseases, didn't we? Parkinson's disease, migraine, clean air for brain health.
Dementia, epilepsy, strokes. I agree that I think we have been discussing this for many years because now all of us are working in the field of advocacy for more than 10 years. So we have our US colleagues. So we have discussed this idea with our US colleagues. We have discussed this with Elaine and Eric, who was working with the American Academy of Neurology. Dr. Mahindi Datta was also involved in the discussion. And Griswold Wolfgang, who is a very strong advocate for neurology for, I think, 15, 20 years.
Yes.
So we have discussed this idea for many years. And I think it kind of consolidated in 2013 when, and I think I would give all the credit to Dr. Hachinsky because he was the president of World Federation of Neurology. And he agreed to that and he basically embraced that idea. And he put us on the national delegates meeting that we should go ahead and start that program. And now with the effort of the World Brain Day Committee, which is also a global committee, we have membership from all across the globe. And now Tissa, you are the chairman of the committee. So I think for the last couple of years, we have got a lot of professional help. And that has developed a tremendous strength. So we have now a professional team working with us, and now we have support from relevant organizations, and now we have neurology community, and now public health community, and a specialized organizations. So I think all of this has created a momentum, and I would give credit to all of the above, which really has geared this World Brain Day activity. And this World Brain Day is just a name, but basically we are promoting brain health and we are promoting neurological health and improving neurological care across the globe. So that's our goal, and which is a huge goal. And everyone, I think we should be able to get everyone involved in this goal and mission to improve brain health of the global or the population of the world and improve neurological care across the globe.
Absolutely. I mean, even when you reflect on this current pandemic, the Wasay, when we look at it, our future as human species, so Homo sapiens sapiens, is actually at a crossroad right now. If the virus mutates super fast, I don't want to scare viewers, but if the virus spreads super fast to the extent that the currently available vaccines or technology that we have is unable to contain, or the so-called R value come close to 10, 12, 15, then basically we are busted. So but we do know the only way to contain this virus is two things. One is how the virus is going to behave itself, and the other aspect is behavior of us as human beings. And the behavior of us as human beings is not going to be decided in your foot, it is going to be decided in your brain. So even to deal with this pandemic, a very clear thinking, a strong mindset, a global approach, global agenda, all these things has to come from well-functioning brains. So this is a perfect example how for the existence of human species worldwide, how critically important better brain health and better brain function is, isn't it?
I agree. I think humankind has dealt pretty well with this pandemic. You know, it's truly the largest ever pandemic in the human history. But humankind has dealt it pretty well, and I think that we are now closing off this pandemic, and I'm pretty hopeful and optimistic that maybe in next 6 months' time or by the start of 2022, The virus is not going to go away. Virus is going to stay with us, but the mortality related to the virus, the disease, the severity of the disease, I think that we will be able to handle by the end of this year. One important area, I think, which needs more awareness, that still a large number of world population think that this COVID is a lung disease. Mm-hmm. And what we have learned from research and data, that about 30% of patients who have this COVID infection, they develop neurological symptoms. So it goes into their olfactory nerves or taste nerves, or even into the brain, thalamus, hypothalamus, blood vessels. So for us, it's a neurological disease. And you know that ACE receptors are present everywhere in the brain. So ACE2 receptors. So I think the most important impact, what we have learned as a neurologist, that we have learned a lot about the impact of viruses on human brain, and how human brain behaves to that, and how it changes, and how a healthy brain can handle infections or pandemics in future. So our behavior and mechanism of disease and future interventions, I think this has been a great learning experience for neurology community and people who are dealing with brain health, and for the whole health community, and even for the whole humankind. I think even our young students, young kids, they have learned valuable lessons of their life during this pandemic. They have been on online schooling and classes for a year, but they have learned valuable lessons of life. And that's, I think, is important for human behavior, that we continue to learn whatever the circumstances are, and we continue to learn good things on how to cope with things, and how to handle pandemics or epidemics, and how to keep ourselves healthy, and how to survive, and how to contribute to the community. So I think these 1.5 years have been great for the humankind, that we have gone through this, and we are able to survive. And not only we are able to survive, we are able to contribute, and hopefully we will be able to get through this, and this will make our humankind even better and stronger.
I totally agree. I think you are absolutely right. When we look at post COVID-19 problems, which we described as post COVID-19 neurological syndrome, is very much similar to what we see after stroke, for that matter, or after post concussive syndrome. So the long-term effects of COVID-19 is going to be most impactful in the field of brain health. And you are also perfectly right by saying that the pandemic is basically making us better species on this planet than what we used to be 1.5 years ago. We are suddenly reminded of that you cannot eat money, or you cannot eat qualifications. How it is useful to be kind and compassionate and caring to each others, and how it is important for us to work together to recognize the common enemy and battle these issues, which we have been talking about when we were talking about brain health for more than a decade now, isn't it? Every time we meet, we talk about one brain health, the brain health, supreme wealth, and all those catchy terms. So thank you for all those wise ideas. Finally, how do you want our colleagues all over the world? You know that our partner organization this year is massive Multiple Sclerosis International Federation, which has their presence in well over 100 countries. So they are a massive organization. And we are partnering with the rest of the other usual suspects, American Academy of Neurology, European Academy of Neurology, Asia Oceania Association of Neurologists, African Academy of Neurology, Pan-American neurology groups, the Arabs, everybody basically, from east to west, from north to south. So that's our colleagues and our patients and caregivers. What is your message for them to use the material that we created as best as they can throughout the World Brain Day campaign, and specifically on the day of the World Brain Day, which is 22nd of July?
Sure.
What is your message?
I think what I would like to do, that 22nd July, what I would ask our colleagues like the neurologists, doctors, medical community, patients and their family members to just make a 30-second video endorsing this World Brain Day and what is your message on World Brain Day, and just post it on Twitter, post it on Instagram, post it on Facebook or whatever social media access you have. We are hoping that 1 million people in the world will be able to post a message on this day, and that will go to like 100 million people or even more people. So that's going to create a huge impact on public awareness, the healthcare authorities and everyone. So I think we should look at the material, we should look at the message, and every one of us should post a video. Just make a 30-second or 1-minute video from your mobile and just post it on whatever social media platforms you have. And ask everyone, all patients should do that. Every family members of a MS patient should do that. All the physiotherapists, nurses, rehabilitation doctors, neurologists, public health officials. I think we should invite all of them to just become part of this World Brain Day campaign. And we are hoping to get a few million people in the world to become motivated and spread this message. And then we believe that, we will be able to hit the target of 1 billion, which is our target to improve the brain health and awareness related to neurological problems. So I think this is a good time. A lot of people now are very good with social media, messaging and recording because of this pandemic. So I think this is a good time that we could use this media to spread the message. And this message is not for us or for World Federation of Neurology. This message is for the whole humankind. And this message is to basically to improve the brain health and neurological health of people across the globe. So this is a very strong and positive message we should work together to get across the humanity.
So Professor Wasay's request is very simple. I'll reiterate it. You get your smartphone out, whatever the phone that you have, record just a 30-second video clip endorsing and supporting brain health, not because of me or because of Professor Wasay or because of World Federation Neurology, because of you, because of us, because of our kind, because of human brain. Brain health is the most important bit of health that we need right now as humans or humanity. So support us. You can visit our website and it is so easy to do. What he's saying is that it doesn't really matter whether you are a medical student, a physiotherapy student, nursing student, or physician, physiotherapist, nurse, senior, junior, consultant, professor, dean, vice chancellor. Irrespective of this, just get your phone out and then record a very short video clip promoting and endorsing brain health and World Brain Day. And you are more than welcome to visit our website and download a whole lot of material that we have created. They are not copyrighted. They can be used by you at your wish to promote World Brain Day. Did I get that right, Wasay?
Yeah, perfect.
So let's hope that the millions of people would not disappoint us. We want to hit the mark 100 million this year. We have been climbing up, and given that we are so used to lockdown and social media and virtual life, hopefully we would see this through.
Well, you never know. Sometimes you get more than what you think.
Yes. Finally, as my usual rhetoric, we both have our own shelf life in this planet. We are not going to be here forever. We want younger generation to keep up to the task and keep improving. What is your message to young medical student neurology trainees worldwide? Why should they care? Why should they get involved in advocacy at a very early age?
I think because the world is now we know that wherever you are working in a local environment, you are connected to the whole world. So now I think the whole world has to get together to improve our healthcare systems and our health. So this is, I think, is a mindset. It's a change in mindset. Whatever you used to train our medical students and doctors that they will go and see patients and write prescriptions. So that's a role for the doctors. But now I think in this global phenomenon, or in this world of a global village, I think the doctor's role is more than just writing prescriptions. So they have to be part of the healthcare system. They have to be part of the policy makers. They are just important part of this global human community. So I think they have to get out of their shelf and do something for the community, for the humanity. And that's what advocacy is basically. Advocacy is just, if you are working for the humanity and community and your patients and their families, so whatever you are working is basically advocacy. And we invite all the doctors to become advocates for their patients, for brain health, for the humanity, for the community, for the local community, and for the global community. So this is what our message is.
Thank you very much. Everybody knows who Professor Wasay is. To finish off, let's ask from him how he spent his spare time beyond neurology and medicine. Tell us about your work-life balance to finish this interview.
But I only work like 6 hours a day, so that's my work is less. But I do a lot of exercise, reading, talking to a lot of people. I do teach young students and young generations. So I'm kind of a motivational speaker. So I do a lot of other activities. So my work is about 6-7 hours per day. And rest of my time is mostly social work. I'm also involved in a little bit of politics and do a lot of neurology advocacy. So do a lot of teaching courses, public awareness programs, media programs. So most of my time is basically spent outside, kind of helping people and doing good for the community. So that's what I spend time, and that's what I enjoy most.
I think it is very important to put your eggs into different baskets and share the feed your passion in different aspects, so that you would almost never see burnout, isn't it?
Well, that's why I don't burn out.
Right. So stay well and stay safe, Professor Wasay. Thank you very much for your time.
Thanks, Tissa. Thanks for your talk, and hopefully we'll continue to use this platform to promote our advocacy agenda.
Absolutely. We have a lot to do still, and we have to stay safe and well at the same time. Take care.
Thank you.